asking for a $1.1 million investment in preventing child abuse before it occurs in West Virginia. That would include $300,000 for in-home family education programs, which are evidence-based programs that the Centers for Disease Control estimates that abuse and neglect could be reduced up to 40% if these programs are widely available. West Virginia stands to bring in $10.5 million in federal funding over the next 5 years, but we need to make sure that a supplemental appropriation that was appropriated last year is made as a permanent appropriation in this year's budget to maintain our effort for that funding. So we're asking for $300,000 for that. We're also requesting a $600,000 appropriation to expand community prevention programs so that every county in the state has a child abuse prevention team. These partnership prevention teams are doing excellent work on a variety of things, from parent mutual help support groups, child sexual abuse prevention, home visiting programs, a wide variety of programs, after-school programs as well. So we'd like to see that expanded. We know that too many counties don't have a partnership prevention team. We currently have 40 in 40 counties. We'd like to see that expand statewide, and the $600,000 appropriation will help us do that. And our last request is $200,000 appropriation for public awareness and education efforts. This would help us to sustain and expand the Our Babies Safe and Sound campaign, which is geared towards protecting infants while they sleep. Unfortunately, in West Virginia, we have a huge problem with infant safe sleep, where once every 10 days, or three babies every month, are dying due to accidental suffocation, where they're sleeping in an unsafe adult bed, on a couch, other adult furniture, co-sleeping, and it's really the leading cause of death of infants over 1 month of age in West Virginia. So we'd like to expand that program. We'd also like to expand a pilot project which is called the Period of Purple Crying. It's an evidence-based approach that prevents traumatic brain injury and shaken baby syndrome. It's currently being implemented at 4 of the leading hospitals in West Virginia. We'd like to see that expand statewide, and the legislature support will help make that happen. And finally, there's a program called Stewards of Children, which is a child sexual abuse prevention program. Again, evidence-based, a nationally recognized program. We'd like to expand that training to train 3,000 adults in West Virginia. The statistics show that for every 1 adult who's trained, 10 children receive additional protection from child sexual abuse. So if we can get this support, train 3,000 adults in this curriculum, then we can provide additional protection for 30,000 West Virginia children. Our long-term goal with that is that we could train 5% of the state's adult population, which would be a tipping point to help us really turn the tide against child sexual abuse as a culture and as a societal level. So we're excited about that. Together, this $1.1 million investment represents only $2.85 for every child under age 18 in West Virginia. So we hope that the legislature will see that as a worthy investment, because kids are certainly worth it.